Today we welcome Alex Gouliaev, CEO of Nuevolution. Welcome.
Thank you.
You've been listed on Nasdaq First North since December 2015. What are the main developments you would like to highlight during the past years?
We've had a very busy year. I would categorize it into three groups. From research, we have identified our candidate and backup and fully characterized them. We have pushed them forward so that we can now do kilogram scale production, which is ongoing for the program, with the aims that during next year we can do regulatory toxicology testing. So that's been a very important achievement for the company in that project. We have also another project where we have progressed significantly. It's a very difficult target where today there is injectable medicines, and what we think we can offer here is tablet-based medicines instead, and that's also been progressed very well during the year. So that's from research. In collaborations already ongoing, we have picked up a milestone from our Novartis collaboration. We did that in February, and we have expanded our Janssen collaboration. And on the business side, which is the third category, we have, first of all, achieved a major agreement with Amgen in October, just a few months ago, so that's 1.5 months ago. And we're working hard to go for the next one, which is most likely going to be an out-licensing of our raw gamma T program.
So your leading program is so-called ROR gamma inhibitor for chronic inflammatory disease. Can you explain why this target is interesting and advantageous compared to existing treatments on the market?
Yeah, so today you actually have very efficacious medicines available. The unfortunate thing is that they are used as injectables, so every patient needs to have it as an injection. Besides that, it's extremely costly. So if, for example, you are psoriatic patient, the initial price is about 50,000 Swedish kronor the first month, and then it's about 11,000 Swedish kronor per month thereafter. And then there's still room for improvement on the safety side. In our raw gamma program, we are able to achieve the same efficacy as you can do with antibodies. We have seen that in animal models. We have seen that we have at least as good safety as you have with the antibodies. And then we can offer a tablet-based solution instead of the injectable, which also has the promise to be safer than the injectables that you have today.
And what are your plans for this project the coming year?
Well, it's moving full speed ahead. Right now we are doing the kilogram scale production, as I just explained, and that should be completed during the first calendar quarter of next year. And once we have the material available, so kilogram scale material available, we can do the regulatory toxicology, which will then allow us later in the year to file documents to apply for approval for starting human clinical testing later in the year, or start 2018.
And you have changed your model for collaboration on your drug discovery technology. The recent deal with Amgen is a good example. Could you explain the advantages of your new business model?
Yeah, we will look a lot at risk. Biotech is in general associated with a lot of upside, but also significant risk. How can you operate your biotech business in a less risky manner? That's been our approach to it. So whenever you have a new program, you know that there's always a risk on the science side. Everyone knows that you cannot predict science, so there's a risk there. But few actually think about that there's a significant risk on the business side, because you don't know if anyone is willing to buy what you believe is the best program in the world. If the world doesn't believe you have the best program, then they may not be willing to buy it, and you may not be able to achieve the financial terms you were hoping for. So in our collaboration with Amgen, we actually secure a partner from day one. So when we invest in programs in that collaboration, we know we already have the partner on board. And if we are successful, then we will see quite significant payments up to $410 million per successful program. So for us, it's very attractive. It means that we can invest in programs, create shareholder value, have revenues coming from that, while having less risk when we invest in research.
How is your current financial position? Do you have sufficient funding for your upcoming activities?
We are very well funded right now, and that's of course a result of a very successful IPO in December of last year when we raised 250 million Swedish kronor. Also, the income that we have had during the year, especially from the Novartis milestone payment. So the Q1 result was a cash position of just above 170 million Swedish kronor, enough to support the runway for roughly 2 years without any income whatsoever. That's not the plan. The plan is that we will do deals. We are pushing hard for out-licensing of our RAW program, and if we are successful with that, then of course new cash will come in, and we will even have more cash available to execute the strategy that we have laid out in connection with the IPO.
Thank you very much, Alex.
Thank you.